The country is already the 20th nation with the most number of total coronavirus cases in the world as of Thursday. And today, the health department recorded more than 2,600 new cases, bringing the total to over 316,600. But much like what authorities said in the previous comparisons of the Philippines with other countries, the health department says ranking alone on the total number of cases is not the only basis in measuring how the country is faring in its pandemic response. Let's bring in our Carolyn Bongkin. Carolyn, does the country's worldwide ranking in the number of COVID-19 cases not matter to the health department?
Well, for the health department, that's just one aspect in assessing the government's pandemic response. Although the Philippines has more cumulative COVID-19 cases than the other countries, health spokesperson Maria Rosario Vergeire said this doesn't mean that the government is doing poorly. She said that the healthcare system can now handle more cases than before. The case fatality rate is already below 2% from over 4% in June, and the recovery rate is around 80%.
Umabot tayo dun sa time na talagang kailangan na nag-aantay ang mga pasyente sa labas ng ospital, hindi nakakarating sa ospital. But now, we have already expanded our units in our hospitals. Nakatulong na maigi ang mga private sector working with us.
She said this ranking is only based on the cumulative number of cases and not the number of people who still have the virus. The health department sees a downward trend of cases in the past weeks. Octa researcher Guido David said the same thing, adding that we could have had more cases if Metro Manila and the other areas with high number of infections were not placed under a stricter modified ECQ in August. That time, the COVID cases reached an all-time high of almost 7,000 in one day. That's on August 10th, with a total of 129,000 infections in that month alone.
Yung surge ng August, it added a significant number. But right now, we're on a downward trend, so nagsa-slow down na. And it's possible some countries might still overtake us. We might have already 400,000 cases now if we didn't have MECQ.
Of course, these figures can immediately change depending on the public's actions and government's response. Vergeire admitted that a lot of improvements are still needed, such as finding more close contacts, testing more people, and getting real-time data from all laboratories. Again, the daily case average in the past 2 weeks is around 2,700. So that's lower than the August data, but still higher than the figures back in June when the daily cases were only by the hundreds. But back then, the number of people tested was roughly half than those getting tested today. So ideally, you will test more people, but fewer will turn out to be infected. Mai.
Carolyn, Professor David said cases could have reached 400,000 today if there was no MECQ in August. But the government is opening up more sectors this month. You have Boracay, Baguio welcoming more tourists and provincial buses back on the road. How will these impact our COVID-19 situation?
Well, Professor David said that they have yet to see what will happen in the next 2 weeks, in the first 2 weeks of October, before they can make another projection. But based on the trend last September, the Octa researchers projects that there could be 380 to 410,000 by the end of October. But of course, any changes in the status quo, in the community quarantine, in the government guidelines on the movement of people could change or affect this forecast. Mai.
Carolyn Bongkin there reporting. Thank you.